So it's my pleasure to welcome you here to the session on satellite data for global air quality and health, a topic that's near and dear to my heart. We have a tighter schedule today than yesterday and a 10-minute break at the end. So I'll just encourage all speakers to remain on time as we can. There are overhead microphones that should be picking up your voice, so we don't need to wait for microphones when we're in the Q&A session. And we'll be flipping the order of the third and fourth speakers today. So without further ado, I'll turn the platform over to Kevin Cromar from NYU, who will kick off this session.
Thank you, Randall. This is a good sized group. This will be fun. Am I Screen Master or you Screen Master? No, I'm not. Oh, there we go. All right, so this whole session is about international whatever. So my international talk is sharing some thoughts, some lessons from our HAQAST funded work in Latin America. There's 3 points I'd like to make today. This is kind of the summary slide. So if you want to zone out, you've learned what you need to learn from me. The first point I wanted to share with you guys is providing locally derived estimates of local health impacts is critical. And I'll kind of give some examples of why that's the case. But the second point I'd like to emphasize is if you really want to have a broad impact of your applied research, you need to have this ongoing interaction with stakeholders. And I'll give some specific examples by what I mean. And then the third point I'll make is just some specific takeaways from our HAQAST funded project, things we learned about NO2 and air pollution forecasting and risk communication. All right, so these are the 3 points I want to get through my talk today. All right, so how can we unlock meaningful engagement with our international stakeholders? If you've had any experience in this, what you're going to find is if you give a kind of a throwaway line, did you know air pollution kills millions of people every year in the world, or millions of people are above WHO standards? You know, that kind of first sentence of the manuscript throwaway line, no local city cares. What they always say to you is, yeah, but what's going on in our city? Okay, so this idea of needing to know the local functions of the cities you're working in is critical. The example here, you don't need to worry about the details, but on the left is Quito, Ecuador, on the right is Rio. These are some results from our health analysis we provided. You'd expect it to be very similar in terms of the patterning of health risks with key pollutants, but you can see it's not quite the same. Both cities show clear association with NO2. If you're not an epidemiologist, look for the open diamonds being a significant association. But NO2 at the top, you see is important in both cities. Ozone is not important in Rio, but it's very important in Quito. That's a little bit unexpected. You see PM, you see some mixed results, and then a difference with SO2 as well. So if you were just to come in to say Rio and say, hey, we expect in your city, this is what's going on. If you didn't do your own health analysis, you wouldn't realize it's actually a little bit different. And those are just 2 Latin American cities. This is a slide from Brian Duncan's the PI of the HAQAST project we're working on. And he's shown this many times, you might remember it. But we started this project with great ambitions for how we were going to help these local cities make use of NASA data products. And it was a great plan, great stakeholders. And Brian says it very well. I don't want to take his words, but he essentially says that they had kind of this thing like, yeah, but you got to show us first what's really going on in our city, okay? And it was really that once the results I already showed you, once we showed them those health results in their local jurisdiction, it really unlocked the opportunity to do further engagement with them on both health and air quality research. So here's a takeaway that you can remember for your international applied work, is generating these local associations of air quality and health. That's really going to open the door for further engagement on both health and air quality interventions. All right, that was the first point. Let's get to the second point. How can we broaden the impact of our work? I personally view grant funding that you get and the papers we publish, those aren't end products, okay? Those are really intermediate steps to have the impact that we want to see when doing international applied work. And if we want to have really a broad, high impact results from our research, we need to make sure we're having consistent engagement with our stakeholders throughout the project. So I kind of just mocked up this daisy chain, right? What I mean throughout the process is you want to be working with these stakeholders from the very start, identifying the problems you're going to address, working with them to develop that project, figure out how you're going to generate the knowledge needed to inform their local decision making. Data acquisition, I think, is critical to have them involved. After you get your results, working with them to put that into a context. Does this make sense with what their experience is? How do you interpret those results in lieu of what they experience on a day-to-day basis? And then whatever interventions that may come from your work, obviously you're going to want to stay involved with your stakeholders. I'm going to give just a few examples from our current HAQAST funded work. These are just things that we ended up doing with our stakeholders that were unexpected. We didn't plan to do it on the outset. It came about organically through this kind of ongoing interaction. The first thing that we did with them, and if you ask the stakeholders, they would tell you these are some of the most important things that we did with them. For our cities, we assessed and reported to their agency leadership the adequacy of their existing ground-based monitoring network. Okay? This actually ended up being a big deal for both of our cities we worked with. With one of them, we explored how satellite data could potentially inform the placement of additional sensors if they wanted to make some expansion decisions. And we also added into our health analysis cardiovascular health outcomes to help one of our cities try to figure out if maybe there would warrant additional PM 2.5 monitoring. The second unexpected impact we had working with our cities, we hadn't initially planned, is we really helped identify and provide recommendations for how they're currently doing their I call it forecasting. It's not really forecasting. How they're currently doing their estimates of future pollution versus what might be a better approach. We conducted some quantitative analysis I'll talk about in a second, showing that some NASA data products would be a better fit for compared to what they're currently doing. And then also we made specific recommendations to agency leadership through both written reports and meetings we had with agency leadership. And then the last point I want to make of kind of an unexpected broader impact is throughout the project, we worked hard to build capacity of our civil servant stakeholders. Sometimes that means working a little bit slower, but by teaching them skills, they're going to be better able to tackle future problems long after we're done collaborating with them. And this is something that we found meaningful that was important as well. Okay, let me give you just a few takeaway points. Randall, how are we doing on time?
I think they're doing.
A couple minutes left. Great. Let me give you some project-specific findings for our Latin American cities. I would say as we're getting to the end of this HAQAST project, we're really on the precipice in our cities by helping them have a major breakthrough in how they communicate air quality to the public and doing so in a way that will actually protect public health in a meaningful way. I'm showing here, you don't need to worry about the details, but one thing we've been working with Christoph Keller, who's recently left NASA, and Sarah Lazaruk, who works with me, is really building tools that can take these NASA data products and make it both available to the stakeholders, but first validate it for them so they can move forward and use it with confidence. And they've been putting a lot of work in this API maker that can be used to get these results to the stakeholders. All right, so you might have seen something similar to this. If you're familiar with the US AQI Air Quality Index, I'm sure you might have seen these types of numbers, these types of colors. Essentially what every city around the world does to some extent is they take the raw pollution values, they convert it to some index color value category, and then whichever pollutant might be worse that day, they communicate that to the public, okay? So imagine yourself, you're setting out that the stakeholder wants you to help them with their risk communication tools. How would you even say, are they doing good? Are they doing bad? I mean, it seems rigorous, right? They have numbers for all the pollutants, that's good. They have categories, it seems rigorous, that's good. What you realize if you dig into this is these messages on the right-hand column, even if you had perfect pollution estimates to give to the public, there's really not a lot of actual information they have, right? If someone had COPD, if a child had asthma, do you really know what you need to do to protect yourself based on these colors? Probably not. So we have a lot of work to do to improve the health messaging. And then what I'll tell you about right now is these categories, while it gives the appearance of some level of rigor and thought, it's actually somewhat arbitrary. And then the levels don't really line up with health risks. And let me show you what I mean here. There's a lot of information we could show. I'll just show two figures here to make the point. On the figure on the left, I'm showing how many days in our study period, or a subset of our study period, were driven by each key pollutant for what we communicate to the public. So like I said, you come up with the index value for each pollutant, whichever one's highest, you would say, oh, it's highest for ozone and bound, so today's a bad day. Or it's highest for PM and moderate, it's a moderate day. The left table here is showing how many days is driven by each pollutant. So you can see that most of the days are driven by PM 10, a little bit PM 2.5, and then secondary is ozone. Look at NO2 there. It's almost never being reported to the public. It's never the driver pollutant for the air quality index that they're using. That's a problem because when you look at the health results we did with them, if you look in the red box that's been drawn for you there, NO2 has by far the most consistent association with adverse health risk in this city. So if that's what's driving the health risk, but it's not what's driving the risk communication values, this disconnect is a clear problem for their risk communication efforts. And as an end result, if you look just left of the NO2 box, right here, you can see that for NO2, we still have these good associations. This is the index values. Those good associations go away. So essentially for Rio in this case, their index values are not associated with adverse health outcomes. That's a problem. That's something we're going to work with them to fix. Finally, this is the last point I'll make. The current tools they're using to actually say what's the pollution value for the next day, they're just using yesterday's value to predict today's pollution, which is not actually altogether a bad idea, but there are better ways to do it. The bias corrected GOCF output that we've been working on with Christoph and Emma and their team is not just adequate, it's actually quite good. So you can see the associations between their current method versus if they'd moved to the GOCF model. And you can see it's very good for NO2, very good for ozone, very good for PM. We're recommending that they use this moving forward and they can do so with confidence. All right, these are the 3 points I went through. My main takeaway is let's keep a good focus on having broad impact. Let's not just celebrate the grant funding in the papers. And if you do that, these 3 techniques will really help you have a broad impact in your work. Thank you.
Thank you, Kevin. As usual, we'll hold questions until the end for a panel discussion. Our next speaker will be Dohyung Kim from UNICEF.
Nice to meet you, everyone. My name is Dohyung Kim. Thank you so much for this opportunity to introduce our work at the UNICEF. So I'm working on this climate-related index called CCRI, which stands for the Children's Climate Risk Index. So we at the UNICEF initially started this effort in 2020, and currently we are trying to enhance this index since our previous effort was not really ideal in terms of the building this method, especially finding the proper threshold and the proper indicators to build this index for children. So let me briefly introduce about the CCRI first. So this is a kind of composite index, and to comprehensively to see and assess the exposure of the children to the environmental shocks and the risk, and also their vulnerability to the risks. So in order to build this composite index, we are using the different variables and indicators, which we call like mostly in 2 groups, pillar 1 and pillar 2. Pillar 1 includes the most of the environmental and climatal variables and indicating the risk exposure to children. And the pillar 2 is children's vulnerability to those shocks. So those are mostly coming from the census data or ground survey data. With this index, we aim to see where those children are most exposed and vulnerable to the changing climate and the environmental hazards. So as a result, we get the numbers and normalized numbers for each countries, and then we can use that to rank those countries into to build some insights so that we can use for the global advocacy and to provide the information when it comes to the supporting children in different countries. And this can be used to decide where this intervention is needed to support the vulnerable children against the climate changes. So this is the detailed view of these two pillars. The first pillar includes different variables and indicators, including water scarcity and information on floods and cyclones and vector-borne diseases like dengue and malaria. And also it includes the indicators around the heat waves and air pollution and soil and water pollution. So for the child vulnerability, we collect the child health and nutrition related information at the global and country level, and also indicator for education and WASH and poverty and the social protection. So those indicators are linked with the operations by different sectors in the UNICEF. So again, we are aiming at helping those operations by different sectors. So this is showing much more details how we use these indicators to decide the exposure of the children to those individual indicators. So one of the most criticized the method that in developing this method is like we kind of arbitrarily setting up a threshold like 75% out of all this country average to decide where the extreme cases and the risk is existing. So that is something that we are trying to improve in the next effort to enhance this CCI. So this is the other variables and the way that we calculate these exposures. And this is the pillar 2, showing much more details and the way that we calculated this threshold and exposure. So this is a kind of output which is very simple at the global level. We show the length based on this CCRI value, where those problems based on the climate change and environmental risk is serious, and how based on the how many children are exposed to those risks. So again, there are a lot of limitations in our current approach in building this index. Mostly, there is a lack of high resolution data in certain regions, so that will make us to drop completely in using that kind of indicator. And there's another limitations because of the lack of the global scale data. And also this indicator mostly come as a snapshot at the global scale. So whenever we try to update our index, there's a lack of temporal, multi-temporal data. So that is another limitations. So another serious problem is that this index has been built for each countries at the scale of the country. So when it comes to providing the actionable insight, there is not many detailed information that we can give from. So understanding these limitations, we can see there are lots of possibility in applying Earth observation data. So since satellite observation cover the entire globe country, so we can get more recent data and updated information more frequently. And it can also provide access to the higher resolution climate data. With this possibility, we can enhance our effort with the increased and more indicators. For example, we haven't included the information about the fire risk or urban heat island and more or better information about the flood. And for air pollution, we previously just used the PM2.5 data, but also trying to include other indicators from different satellite observation, like nitrogen dioxide. So, as a conclusion, this effort around CCRI provides a means to serve the children vulnerable to climate change and environmental risk. But there are a lot of rooms to improve, and we are making that effort currently, and hope that we can get more helps from this Earth observation community to improve the current limitation that we have in building the CCRI. Thank you.
Thank you. Our third speaker for this session will be Pallavi Pant from the Health Effects Institute.
Thank you, Randall. And to try and find my slides. Okay, there we go. Good morning, everyone. I'm Pallavi Pant, and I work at the Health Effects Institute. So the question that I've been thinking about is how can we best use satellite data for understanding what the impacts on human health are in different places around the world. And for those of you who are not familiar with the Health Effects Institute, we are a nonprofit institution based here in Boston. And we've been doing research and supporting research on how air pollution affects people's health for over 4 decades. So this is really a question that is near and dear to our hearts. One of the things that I think I do not need to convince this group about is that most of the people around the world are getting exposed to poor air quality. And we often see maps like this trying to tell us how are the countries doing with respect to the WHO air quality guidelines, their national standards, and other forms of related information, just to give people a sense of how bad are the air pollution levels. This information often gets picked up also in news media and is communicated in a variety of ways. But a challenge remains, which is a lot of places on maps like this do not actually have ground monitoring stations, especially parts of Asia, parts of Africa, and some parts of Latin America as well. There are huge gaps in what we know from ground measurements. And that has meant in certain cases that we haven't been able to study how air pollution is impacting people's health over the same periods of time as availability of data in places like the US or Europe have allowed us to study them. So a lot of the global evidence tends to be from those countries because we've had the monitoring data. So I want to talk about 3 ways in which the availability of satellite estimates has enabled us to fill some gaps and start to think about questions that are relevant for either particular regions or for answering questions related to specific health outcomes that we are most interested in. And the first example that I want to talk about is something we work on, I work on every day, which is the State of Global Air Initiative. This is essentially an initiative aimed at providing access to air quality and health impact information for countries and cities around the world to people in ways that they can most easily use the information. So the platform is not meant for most of the people in this room. It's not for researchers. It is meant for nonprofit groups and journalists and some policymakers who may be interested in understanding what are the patterns in air quality in my region, how does my city or my country compare with others. And this is work that we've been doing in partnership with the Global Burden of Disease Study at Institute for Health Metrics and Evaluation. And what underpins a lot of the data that we use in these types of analysis and on our website is satellite-derived estimates for different pollutants so that we know on average what are the exposure levels for PM2.5, for ozone, and more recently also for nitrogen dioxide. And Randall's work in particular has been very transformational in allowing us to do these types of estimates. And just a quick plug, we are actually going to be releasing the next version of the State of Global Air Report in a couple of weeks, so please stay tuned for that. And it is in partnership with UNICEF, so I'm really glad I'm following a speaker from UNICEF here. But what these data and availability of exposure estimates at the national level, at the global scale, allow us to do is produce maps like the one you just saw. They also allow us to look at city level hotspots so that we can start to say where are the biggest pain points at the global scale. And as Kevin very nicely illustrated, often when you go to a local policymaker, they won't be satisfied with this. They're going to need information for their city, estimates on health for their city, and what's going to work for me and where I am right now. So the other way that the satellite data has been really useful and transformational has been in conducting health studies, either at the city level or at the national level, or in countries where we've traditionally not seen a lot of health evidence being presented. That has come in a variety of ways again. So people have tried to use the satellite-derived estimates that are available for pollutants to look at trends in air quality. And I've just pulled an example from Ethiopia, where we don't have a lot of air quality monitors on the ground. So we don't have historical data on what those trends might have looked like. Are we, increasing the levels of PM2.5? Are those levels going down over time? We cannot ascertain that at the moment without the use of satellite data. And the caveat I will add here is that because you saw those big patches of missing ground monitoring information in certain parts of the world, these data also tend to be more uncertain. So for those of you who are thinking about what kinds of research should I be doing that can help plug the gaps, that's one piece that we still need to figure out. How can we best reduce uncertainties in our satellite-derived estimates? How can we best bring together the variety of data sets that are now starting to be available, satellite, regulatory grade monitors, low-cost sensors, and other pieces of information to make sure that our estimates over time continue to get more certain. But the other piece where the availability of this global data set, and in some cases regional versions of this data set, have been particularly helpful are in studying the association between air pollution, so it could be a single pollutant in most cases, and a particular health outcome. Up here, you're going to see some examples from different places. In India, the satellite data has now been used extensively to study a variety of health outcomes with administrative health data sets so that we start to build the evidence when local policymakers start to ask questions about, that's all fine and good, you know this globally, but what about my country? What about my city? These data can also enable some of those types of decision making and informing the decision making. And even in places where we've had traditionally good ground-based monitoring stations, like the example at the bottom here, we have seen that by fusing the satellite data that are available and other forms of data that are available, we can actually produce better estimates of exposure, because that's a central piece of data we need to really study the association between air pollution and health outcomes. So applications are aplenty, both in the global south and parts of Asia and Africa, where ground monitoring data do not exist, but also in places where we've traditionally had a lot of this information. And then the third way that this data has been useful, transformational, and hopefully will continue along that trajectory is in engaging more people and in using some of these data points in ways that can be relevant for people to connect with the data. As Kevin said, you see these abstract numbers with air quality indices, and yeah, they're helpful a little bit, but sometimes you also get the question, but what does it really mean for me, and how am I getting exposed to this? And especially in places that have a lot of regional air pollution or transboundary air pollution, satellite data is actually being used now to understand where is the pollution coming from, what types of action can we take, and also if we are introducing policy interventions, is that really changing the level of pollution? Two examples I want to point out, which are both very interesting. One is from Southeast Asia, where some of you may know regional transboundary air pollution as a result of peat fires has become a bigger and bigger issue over time. And countries across the region have been trying to work together, but also they're trying to figure out where is the pollution coming from, who is it impacting, because often the peat fires don't necessarily impact that location. The pollution travels long distances. And this example is from a media article that came out in 2023, where data from NOAA satellites was used to by the Malaysian government to say, we are getting impacted by your air pollution, so you need to fix the problem. And we're monitoring this data set continuously to see whether interventions have an impact. The other example, which may be harder to read here, is again related to fires, but from India this time, where agricultural residue burning is very common in certain seasons and really drives both the air pollution levels in certain parts of the year, but also the public discourse on air pollution, because it becomes a very visible thing you can experience and see. And in the last 5 to 7 years, people have started using data on fires pretty extensively, not only to monitor what are we expecting in terms of air pollution levels or the contribution of these fires to air pollution, but also for tracking, oh, the government said they're going to be doing interventions A, B, and C. So let's look month over month, year over year. Are we seeing a reduction in the numbers of fires? And it is not just the scientists who are doing this. The tweet I pulled is from a NASA scientist, so it has a lot of rigorous information. But if you, scroll through social media, you'll also find just average general people pointing out, images from NASA data to say, that's where the fires are. How is it affecting me? How is it affecting you? So there's really opportunities to, use the data sets for rigorous scientific research, for trying to create data points that can start conversations, and for engaging the public, the policymakers, in how these different sources of pollution are impacting our health. So I'll stop with that, and I will just thank all of you in this room who have been working with these data, and please continue to produce them at finer resolution and reduce uncertainties so we can continue to work with them. Thank you very much.
Thank you, Pallavi. And our final speaker for this session will be Marianthi-Kioumourtzoglou. I got that close anyway.
That was good, yes. No one should ever have to say my last name. As the slides come up, the reason for the change in order was due to technical difficulties, but I'm so glad Pallavi went first, because my presentation follows very well after her. So thank you. She has that was the introduction, I guess. We'll talk about uncertainty a lot. Awesome, thank you. And this is a work that is funded by a few different agencies. The development, this is a tool, an air pollution prediction tool that also allows for uncertainty characterization. The methods development is funded by an NIH grant that Randall and Arlise are co-eyes, and we also have an application and optimization specifically for New York State and the Northeast that are part of Arlene's HAQAST team. So this is, they say Research Take a Village. This is a city, I think, across the two grants, sorry. So air pollution, that's why we all are here, has been linked to numerous adverse health outcomes, and to improve exposure assessment, we need sophisticated spatiotemporal prediction models, because as Pallavi said, there are many parts where, well, ground monitoring is not enough, but even in high dense monitoring areas. So an amazing opportunity has been, since we started incorporating satellite data, and more recently, teams have been using machine learning algorithms that can improve predictive accuracy even more. And that has resulted in very high spatial and temporal resolutions. For example, we now have predictions that are daily at 1 by 1 kilometer grids. Fantastic. To date, and that's an issue in health studies, most health studies use predictions for a single model to assign exposures. And they assume that that single model is precise and accurate at each time and space point. However, if we could combination from multiple prediction models, and I will be using models and products interchangeably. I know these things mean different things in different fields, so sorry if I cause any confusion about that. But combining information from multiple prediction models or sources, as Pallavi said earlier, can lead to more accurate predictions. Enter ensemble prediction modeling. However, there are multiple ensemble models already. Some limitations exist in those models. So for example, one is that the prediction errors are independent across the different models. The second is that model-specific contributions are constant across space and time. That is important because when we want to assess effect modification by factors that vary across space, then we may identify that modification that is not due to those factors, but it might be due to errors in our models that correlate in space with those factors. So we do want models that, well, one, perform excellently, but in any, even not that, at least consistently across space and time. Finally, enter uncertainty, our uncertainty spiel. Most models do not provide uncertainty estimates for use in health analysis. Only very recently, prediction models, single or ensembles, have started to provide spatiotemporal uncertainty. These are just some examples. But, oh, this is the, okay. However, all these uncertainties are great, but they do not use the same definition. They're all very useful, have useful information, but they cannot really be compared to each other because every uncertainty estimate provides a somewhat different information on different uncertainty components. And most importantly, as I said earlier, we now have multiple prediction models, at least across the United States and across the world. No uncertainty estimate today, to the best of our knowledge, incorporates differences across models, across different products, especially where we do not have monitoring. You know, a model can give 5, another model can give 10, a model can give 2. This is some uncertainty that is important to incorporate when we're assessing health effects. So in health models so far, we have assumed that the predicted exposures are true exposures without bias or uncertainty. Bias in the predictions is exposure measurement error and can bias the effect estimates, but also failure to propagate uncertainty in the predictions can result in invalid inferences of the effect estimates. And therefore, our conclusions with both of these in both of these situations can change. And this is not, we're not in one or the other, these happen at the same time. So we've started several years ago now, thinking about how we can address these limitations. And we have developed a model called Bayesian non-parametric ensemble, or BNE. You may have heard about BNE around yesterday. It's a Bayesian machine learning tool that integrates diverse collection of existing model predictions made at different space and time resolutions. It adaptively combines predictions of each candidate model by its spatiotemporal predictive accuracy, by estimating spatiotemporal weights, and that results in consistency across time and space. And most importantly, it provides accurate estimates of the spatially varying predictive uncertainty in the exact same spatial and temporal resolution as the predictions, accounting for them, are also accounting for model-to-model variability. So to the best of our knowledge, again, this is the first time that we were able to do this. This is a very simplified version of what the model does. I will say, when I said this is a city, this was a lot of algorithm development in machine learning. So we're not just adapting an existing algorithm. So the publications, the references I have at the bottom are actually papers of the methods development published at very competitive machine learning conferences. So I honestly don't fully understand completely how the algorithm works. So this is just a simplified version of it. So we assume that we have evolution special process. Let's say that's 20.5 concentrations. We have K-based models. So we augment a classic ensemble model, the just sum weighted average, with some non-parametric machinery. So if these are the predictions of each model, these are the weights that spatial adaptive model combination. And also we have this delta X that corrects spatially, sorry about that, spatially varying systematic bias in our predictions. And we use a lot of Gaussian processes for all of this. So this is just one example. These are annual averages of 2010 BNE estimates for fine particles. On the, on the left-hand side are the predictions. On the right-hand side are the uncertainties, annual average. Uncertainty can arise for two reasons. For example, up here in Maine, we have high uncertainty because it's very far away from any monitoring stations. Here in the West, uncertainty arises by disagreement across the models and also limited monitoring sites. For more information, because I'm going through a very quick conceptual overview of BNE, Jaime Benavides, they're all sitting over there, had an excellent flash talk yesterday, and Vijay Kumar and Carlos Carrillo Gallegos had a poster. It might be down. The poster is also up on the website if you are interested for more details on how the model performs. But this is a talk about global satellite information. So this is my one slide on, yes, thank you, on taking BNE globally. So we are planning to extend BNE globally because of the limitations, or not limitations, challenging in developing the algorithm. We haven't had the chance to do that yet, but we do think it's very important. We do expect challenging for training the model, as if you saw Pallavi's map of where monitoring stations are, there are big chunks of space that we have no monitoring stations whatsoever. The model is trained on observed data, so that will be a challenge that we'll need to figure out. But it's also a great opportunity because if this works, we can identify high uncertainty spots for optimal monitoring station placement, and we can report weights back to developers of input models or people analyzing satellite data and fusing with, air quality modeling, etc., to improve each input product. And then ultimately, what we hope is that uncertainty estimates can be useful for health impact assessments, GBD estimates, health analysis, etc., etc. As I said, it takes time. Randall and Arlene have been extremely helpful, but these amazing people are my team who do all the work and make this fun and exciting. And I would like to show Jaime, Vijay, and Carlos, who are doing all the work in this project specifically. And they're all there. Grab them if you have questions. They know more about it than I do. Thank you.
Thank you, Marianthi, and thank you to all the speakers. We'll invite now the speakers to come up and serve as panelists in the front of the room. We have about 10 to 15 minutes for questions. And to start out the Q&A, I'd like to ask a question to all the speakers in that, how can the HAQAST community empower your work? And I'll just allow guests on across the room.
Okay, I can start. I think I already sort of spoke about a couple of things that would be really helpful in continuing to expand work on health impact assessment and the analysis like global burden of disease. One is accessing and being able to use data sets at finer spatial resolution, finer temporal resolution, because that's where the questions come, both from the policymakers and the public. So those types of data will be really helpful. The second thing I will say is I saw and heard and saw some great examples of people starting to stack data sets now so that you can access an entire suite of available input information. I think that is really valuable, and I would love to see more of that, especially when we work in countries, outside the US. Sometimes no data is where we're starting. So the more information we can have in easy to access, somewhat similar formats, so that even the people in those locations do not necessarily have to go through like the challenging process of understanding how each of those data sets work. I would say that will be a huge help. So if anyone in the community wants to work on that or is working on that, please get in touch. I would love to learn more.
Wonderful, thank you.
Okay, so I think you guys are all doing a very wonderful job in making those data, essential data, available and easily to be taken up by users like us. However, there are something to be studied and examined more significantly. For example, as Kevin and Pallavi already mentioned, there is a ambiguity in terms of deciding what is extreme. The driver of our work is to find how this extreme condition significantly affect children's welfare. So there are two ambiguity here. What is the extreme and what is the significance? So in defining this, we're having a lot of trouble actually. So when we build this index, we just, as I briefly mentioned, threshold with the 75% threshold, very arbitrarily decided. And where these numbers comes from, we try our best to take a look at these references and existing researches as much as possible. But there are not much strong guidelines of that. For example, when we try to use the nitrogen dioxide data from the satellite data set, it is not really comparable with this number from the satellite observation with the some standard guidelines, for example, from WHO, because the unit is different. So I really tried hard to find something that I can use to close these gaps, but still there are not many kind of standard way of doing it. So probably that should be studied much more, and then try to build some kind of standard guidelines.
Thank you.
Thank you for this question, actually. So we a huge thank you to the HAQAST teams and teams past, because we were able to tap into the expertise of what you and Arlene are bringing, and that has been extremely helpful in developing this tool. Moving forward, I think what we need and what we would like. What we need, if people have available our products US-wide or globally, PM2.5, NO2, and ozone, we're developing both annual and daily products. So if you are available of products, or if you are aware of products, please let us know. Also data that do not report to, for example, HAQAST in the United States, because we train the models on HAQAST data. So we need other data to externally validate, because many of our products are trained on HAQAST data. So external validation is extremely important. So that's we need. And if anyone is aware of such data sources, please let us know. I think what's very important when you started doing this for us is that this will be a tool for the community, for the modeling community, for the air pollution health community, and for stakeholders. So we want to be able to provide, we will be making all these products when we're finalized and publicly available, and the code, so people can then take the code and apply it to other settings for which they have data. So if you want to test it out, to try it out, please let us know. That would be extremely useful for us to understand how we can make the tool, the package, more user-friendly. But also let us know if you're interested in being involved. I'm looking at Jaime. In a month or two, we would like to hold a session to discuss visualization tools on how to communicate uncertainty to stakeholders, whether that's people who do not know air pollution, do not understand, and how to communicate that, but also to air pollution modelers. So how can that tool be most useful for them to improve products? So my email was on there. Otherwise, touch me or any of us afterwards. Would love to hear from you. Thank you.
Thank you.
I'm a big believer in the goals of HAQAST. I think since the first
generation of HAQAST till now, always been strong on the air quality side. I think we've consistently gotten better from the stakeholder side. I think we're still light and weak on the health and epidemiologist and health researcher side. Hopefully that's something we can do better in round 3 of HAQAST.
Great, thank you. So I'd like to open the floor for questions. I saw Dan Westerveld first, and then I see a couple others in the back.
Yeah, thanks. So this is a question I think probably for Pallavi, but I think maybe others could chime in as well. I'm just wondering if in the epi community and in the health effects community, if there is a demand for satellite-derived products that are trained on like regionally specific ground-based observations. Would that be used, or because I see most of the work done currently is like, with these big global data sets. So I'm just curious if, from your perspective, if that would be useful.
Absolutely. I think people are not using them because they don't exist in all of the locations. And one of the examples I pointed out during my talk was from India, where we have seen that happen. So a research group in India took the global estimates and then adapted them for India-specific monitoring station, monitoring data, et cetera. And that data set is now being used for a number of studies. So I think if similar data sets exist in particular places, and especially if they can leverage local monitoring information that often is not available very easily globally. Even on the map you saw that I pulled up from OpenAQ, there are places where data exists. We just don't know about it, or it is not, it cannot be shared at this point. So 100%. I think if you can build something like that, there is a lot of interest and there will be a lot of use.
Thank you. I saw a question from the back from Arlene.
Sure, thanks. So I might just comment on the last exchange too, that I feel like in the modeling community, we kind of have this, the global modeling community, right? The convention where you have a global inventory, but if you have better information regionally, you replace it. So it seems like maybe that's, a way with the global, sorry, maybe I should stand up, state of the global air, eventually regional replacement where you have better information. But my question was for Dohyung. I was curious about, with this climate risk, children's climate risk index that you've developed, it sounds like, I guess my question is, obviously when we're talking about satellite data, we're limited to present day and maybe looking at trends in the past. I'm wondering if your risk index also has a component of future projections, if you have like a 2025 risk, 2030 risk, or and just sort of how you where you get your information for any future projection you may have.
So yeah, that's a very good question. So at the initial stage, we were thinking about doing that kind of projection, but obviously we are lack of this kind of indicators that provide these predictions toward the future. So we do this kind of so-called thematic analysis. For example, if we can get our hands on this projection coming from the academia or scientific research community, for example, we are also including these indicators for the heat wave. So for that, we can get help with this data set for the temperatures and other variables that can be used to see how the heat wave will be changing in the future. So for these individual indicators, we are planning to do it and also already doing it. But some other things like flood monitoring, we don't have that kind of information. For example, yeah, I mean, we have some data set available, but it's not really available universally. So for that kind of indicator, we have a seriously shortage.
Thank you. I saw a question from the right of Dan.
It's been addressed.
Okay, perfect. Then Young, I saw you next.
Yeah, question for Kevin and Brian. You've done a lot in Latin America, and it basically did it from the ground up. You did your exposure assessment, your localized epi study, your communication. So I wonder, to actually cause this positive change and impact, how long does it take?
Yeah, you can't get it done in one HAQAST cycle. Right? So the relationship needs to be built. right? So you know their needs and they trust you and you know how to work together. But it takes time. And I would say the biggest thing when wanting to have this work is the timing has to be right in terms of whoever's in, because like political cycles, I know it sounds weird, but if someone's elected in the mayor's office 4-year cycle, you can't start working with them year 4 because someone else is going to come in. So the biggest thing I think that we can do to have impact is you got to have buy-in at 2 levels. The civil servant level, you know, the air quality scientists and health people, they're going to kind of work with you. But before you get started, you need to get buy-in from their leadership. Otherwise, you're just going to spin up a project. It's not going to go anywhere. So that's kind of our approach. Get buy-in from the leadership, get the collaboration a level below it, and time it up with whatever cycle they're working on. But I think that's kind of key. If you do that and then you keep in touch with them, I think it's really possible to have high impact with our work. So those are my practical tips for you.
Good idea. Thank you. See another question from the front?
Yeah, I have 2 quick questions. The first one is for Dr. Cromar. You showed 3 lessons. Thank you very much. I want to hear more lessons about how to initiate the community engagement, because where should we start to roll the ball? So can you share some tips, maybe lessons you have?
Do you mean with the actual local public or with the kind of stakeholders?
Let's say you want to engage with disadvantaged community. Yeah. I really want to speak to the residents or talk to the stakeholder to implement the future intervention. For example, just take that. But
yeah, so it's not like Brian and I are walking through the favelas in Rio, engaging with local communities. To me, the biggest need, if you want to have your work trickle down to the public, is understanding what their real needs are. So I was sitting in a meeting once with a consulting team with one of our cities, and the consulting team was pitching them on what you need to do is you need to do a campaign to tell the public that this is a problem, so that then they'll support you in coming up with a solution for it. And it felt very backwards to me. Like, no, you don't tell them there's a problem so you can fix it. You try to understand what are they worried about? What are their concerns? And in terms of air quality, a lot of cities' air quality is not even near the top of the list. And so the idea of jumping into that city and saying, hey, let's do a big air quality project when they have 10 other concerns above that, you want to make sure you're working with locations that air quality is their #1 problem. And then once you do that, we have with Keto, we've been encouraging them to do surveys to understand what the public cares about, what their understanding is. We can't do that, but we work with the stakeholders to understand the needs of the public. And then as researchers, we ask the question, well, what knowledge is needed in order to help make improved public or individual decision-making? And we design our studies to generate that knowledge that can then be put to use for the benefit of the public. So I think that's kind of the process we go through to think about impacting local populations.
Thank you. And my second question for all, because this is my first HAQAST meeting, and my research focuses on indoor air quality. And most of the talks, I would say all talks I have listened to, talking about outdoor, and including the funding, sponsors, they are mainly looking at outdoor. However, indoor is also, important because we stay so long. I want to hear your thoughts on the future, research collaboration or any potential opportunities where some, resource we can leverage to advocate this. If you agree, indoor environment is important.
Okay, that's a great question. We have a 10-minute break. We're at time. So what I'll suggest is challenge you to 10 words per response. We'll go quickly through rapid fire and then we'll move on. Who wants to begin?
Okay, I can start. I think indoor air pollution is a major problem and also depends on the location because the sources that are relevant may be fading quite a bit. Let's talk over coffee to dive into it.
And I think that's very important issue, and it concerns greatly with the children's health. So currently we are focusing on the global scale, but we are also going sub-national. So in that case, probably they will very important and helpful. So we can.
I think it'd be hard to assess indoor air pollution with satellites unless the sources bring up or not meet outside. And also depends why you're conducting the study. Do you want to understand the effects of air pollution, total, personal, or indoor? Very valid. for what regulatory agency do you want to provide information to? And if, for example, it's EPA, they cannot really regulate how they could, so, yeah, so that is.
I think the connection is sharing health data. Everything else is quite separate, but you can share that health data together.
Great. Thank you. Thank you to the audience for all the great questions.